Just to update. Last night I went to the hospital with my dad. Dad took me to get my couple MRIs. The one Dr. Virojanapa ordered. Two of those, like lumbar and thoracic, which are kind of pointless. And the head MRI is kind of pointless, which I was supposed to do today because I don't have any problems in those areas. But there's an outside chance, like it might be like tired cord and whatnot. The important one I'm doing is flexion extension, which is prone, but I found a place in Columbus, Advantage Diagnostics, that does flexion extension. And they said, yeah, we take your insurance. My insurance says they're not in network, but they also said Dr. Virojanapa isn't in network, and they covered him, and I didn't have to pay for it. Really? It was like $20 to see him. And then, so I'm like, I don't think my insurance agency knows what the fuck they're talking about. I think, I don't know. But normally I wouldn't screw around with it, but it's like they're the only place in Columbus that does a flexion extension. Like Ohio Health told me, they're like, yeah, flexion extension isn't something that's done on MRI. And I'm like, yeah, it is. Like, I mean, you can Google it. Like, I don't know, man. I don't know what the fuck old people do, because when they don't know any better, and these people tell them like, oh yeah, sorry, we can't do that kind of MRI, and then they're like, okay, I guess I'll just live with my fucked up neck or whatever, and you know, I know how to use the internet, and like I can be like, yeah, no, you're full of shit. So anyway, I got that scheduled, but I went last night, and my dad took me, and like he he had the brilliant idea while he was out there in the parking lot to get drunk. 'Cause he'd been an alcoholic for a long time, like 25 years or something like that. So I was kind of hesitant to come here to rely on him because he's not reliable. And so, yeah, and then on the way back, like he didn't know where he was. He already can't see that well in the dark, and he's like, messing with his cell phone, not looking at the road, swerving across the center line again and again. And it's just like, what the fuck, dude? Like, give me your phone, focus on the road, shut up. Like, Jesus Christ. It was scary, and he was horrible to me. Like, he was mean. I didn't tell him to shut up, but I was just being as nice as I could, because he's gonna lose his fucking shit if I said anything mean to him, because he was drunk. And he just kept repeating himself, asking the same questions over and over, because it destroys his short-term memory, and has caused him short-term memory problems, like when he's not drunk. Like he'll talk to me about something like 3 times a day. I mean, he's 65, so there's a lot of 65-year-olds out there that don't remember things so good. But it very clearly, like, he drinks and then it's gone. Like, I'm talking 30 seconds later, he's asking me a question about my MRI he already asked me. And I'm just like, you've already asked me that. And then he throws a temper tantrum. Like, fine, I'll just shut up then. And it's like, how are you mad at me? Like, for your own stupidity. Like, jeez, he does that to me every day. Every day he tries to make me feel guilty about him being a fucking dumbass. And I don't say anything to him mean. I'm supportive of him. I'm caring towards him. I try to help him. I got him Bacopa extract, vitamins for his brain. But like, I have to physically hand him the pill and make sure he takes it, because otherwise he'll put it down 5 seconds after I gave it to him and forget to take it. And then I go and I see him, and he's just got a pile of pills that I've been handing him all week. It's like, what the fuck, dude? Like, you need to take the pills. They don't work unless you take them. So anyway, I don't have a ride anymore, because I'm like, I can't trust him. Like, I can't ride with him, because he's, at any given moment he could be fucking drunk, and he can hide it, and I can't tell until we're out on the road, and then he's swerving all over the road, and it's like, fuck me, man. So it's like I can't. He's not a ride, so I can't go to my MRI tonight for my head. I don't know what I'm gonna do for advantage. Maybe if I rest up enough, I can borrow my grandmother's car because it's my grandfather's place. And she's got a car, and um, can't borrow my. Well, I guess I can borrow my dad's car too. But either way, get a car and go down there on my own. And I'm really scared it'll hurt my neck, but I have to get the flexion extension, or there's no way to do surgery on me without that. I mean, I wouldn't if I was him. I don't think he's gonna do surgery anyway. I think the surgeons are. There's just no surgeons out there that are willing to do surgery unless you're willing to pay out of pocket. Because the ones that follow the insurance model are it has to show up on the MRI or it doesn't, or it's not real. And the ones that I mean, like even Dr. Bolognese is like, he goes through insurance and it's like, okay, it didn't, I don't think you have a problem. And it's like people's heads are fucking falling off, and people are like, oh, he's a fucking genius and all this stuff. Like, Dr. Bolognese isn't a fucking genius. He's just the only guy that treated them. And even Dr. Bolognese would say like this treatment, this craniocervical fusion, it's not rocket science. It's not a hard surgery to do. It's in a dangerous area, right? You want to know what you're doing, but it's not complicated. I've had multiple neurosurgeons tell me that. Over total spine, they said the same thing. It's not a complicated surgery. It's easy to do. They didn't want to do it because of, they're idiots. But um, but yeah, people are like, Dr. Bolognese is a genius. It's like he's just the only person that gives people a craniocervical fusion and then now allows them to function. And everyone else is like, whoa, the MRI doesn't show anything. I literally have a 2 millimeter by 4 millimeter tear. It's about 2 millimeters deep, maybe 3, about 4 millimeters wide, on the side of my neck from the cervical collar, like right at like my SCM's here, right? It attaches here on my skull. And right behind that, like if I dig down underneath, right here, there's, I don't know if you can see the sun, but there's a groove that's like 2 inches long, and then it goes into like the muscle further up, like up and around, and it's right where the edge of my soft collar was. And over time, my soft collar like wore that groove into my neck, because that's where my neck would bend, and it wouldn't, and that's where all the strain in my neck would be, which was normally that all that weight is distributed throughout your neck, but then all of it was on the edge of the brace, which of course, I've never heard of, nobody ever talks about. But anyway, I got that groove in my neck. That doesn't show up on an MRI at all. You can't see it. And that's literally the dimensions of ligaments in your spine. Like ligaments in your spine are like 3 millimeters in diameter. And that's a, maybe 3 millimeter groove in my neck that you can't see at all on an MRI. So it's like, I have major fucking tissue damage. It really fucking hurts. It hurts really bad. It's burning right now. It's horrible. And you can't see it on MRI at all. You just can't. And these doctors are like, yeah, well, I was looking at your neck and it looks fine. It's like, they can't fucking see the ligaments at all. They have no fucking idea. You could have fucking, they could look like Pac-Man came through and chewed up all your ligaments, and they're all like, they have like bite marks, like taken out of all of them, and like nobody would know. Like you can't see it. That doesn't mean like you can't see ligament damage at all, but it has to be like catastrophic. It has to be like really, really fucked. The entire ligament has to be fucked for it to show up on an MRI. And even then, you probably won't see it. And I said this before, like Dr. Centeno was saying on a report, like he was looking up MRIs with like how accurate they are on ligaments in the spine. And there was a guy that like died from neck trauma in a car crash. Took an MRI, he was fine. They cut open his body, take the ligaments out, and you look at the ligaments and you're like, Jesus, these are fucked. They're fucked. Like they're totally shredded. But on an MRI, so it's like, oh, these doctors being, oh, I don't really see the problem here. And then they tell you, oh, you got to come in because we got to do like a physical exam. Physical exam is when they like grab your fingers and say, spread your fingers apart. They don't even fucking look at your neck on the physical exam. The neurosurgeon who's going to operate on your neck, when you go see them in person, they don't fucking look at your neck. Like, and I mean, some of them do, I'm sure, but like all the ones I've seen, they don't do that. Like Dr. Virojanapa didn't. He didn't say, let me feel your neck. Let me, move your head around. Like, nothing. Nothing. Like, this is the actual problem right here. Not a goddamn fucking thing. It's just like, nope. We're just, and then they tell you, you have to come in. And it's like, for what? Like, let's just do telehealth because you're not going to touch me. You're not even going to look at me. I mean, it's ridiculous. So, I've kind of given up on neurosurgery, and it's like, I don't know. So I have a decision to make, and I mean, Dr. Virojanapa is not going to do surgery on me. So, um, basically, I'm hoping that when I get disability, then I can apply for euthanasia. Um, and I don't know if the picl is going to make me feel any better. I don't really feel much better. I feel a little stronger moving around. Like I try to get up and do a little more each day. I've been trying to work out every day. I like it no matter what, because I'm like, I've seen people just lay in bed, and if you just lay in bed and you don't work out, like you're fucked. Like it's not like maybe you'll be okay. Like no, you're just fucked. You can't do that. So like, I have to move around, and I don't really like when I talk about moving around. I talk about like I do exercise, like I'm doing like arm curl. I'm leaning up against the wall doing like arm curls. I'm doing like wrist work, full wrist extensions, like chest press, vertical press, which you can do all like leaning against a wall. I can like lean up against something and pull backwards on like bands for my upper back. I can do squats, which my head's in an upright position. Not squats, lunges, like when you walk across the floor, like lunging. Where my head's in an upright position, so that's not being strained. Like calf exercises, shrugs, and some stretching for my neck. I'm careful. Like I'll start out real light, and then do a few seconds a day, and then if that's okay, everything's 4 days later, because 4 days is a good amount of time for connective tissue to catch up. Because muscle, you only need like 2 days to recover. Connective tissue, you need like 4 days, at least for someone my age. I'm 39, so I'll do an exercise and I won't do it again for 4 days. I'll do a stretch, I won't do it again for 4 days. I have some daily stretches I do for like tilt my head to the side, because this area gets really tight, and I'm up to like 20 seconds at a time. I'll do that like 5 times a day, just like really getting the stretch up in here because that gets so tight. And that really pulls on your vertebrae in your neck, which causes your neck to get even more tired, more neck strain. So you have to keep that loose and like hanging from the pull-up bar, stuff like that. So I was doing it really light, and I'm slowly working my way up, and I'm just always doing that and trying to get stronger and stronger and stronger. And I have been improving, but I don't know. So we'll see. We'll see if the picl ever. People are like, oh, it's too early. It'll help. I'm like, it's not really doing shit. It sounds like a little bit like I can't rotate my head left or right, which is the alar ligament. Like, I mean, I just did it, but I mean, like, I can't do it much, and I can't do it like full range, because then I get really dizzy. I get really grinding around my C1, C2, which, so I guess that's not alar. Well, something grinding in my C1, C2. When I'm rotating my head left and right, I can hear it and I can feel it. And that's I'm telling neurosurgeons, like, who are like, I don't know if there's any problems in your C1, C2 area. I'm like, oh, you mean the thing that I heard tear and I'm currently hearing grinding and feel pulling, and I can feel the grinding. I can feel bone on something grinding in my neck in C1, C2 area. And they're like, oh, that's not the issue. I'm like, oh yeah, it's not the fucking, like, these guys are fucking retarded. It's the nicest way I can put it. It's fucking stupid. Because if that happened with my elbow, And like I tore my elbow playing, like lifting weights or playing tennis, and was like, man, I feel it. I can, like, it hurts every time I move it. It's a problem. They wouldn't be like, nah, that's not real. It's probably your wrist that's the problem. That's what they're doing. They're like, I don't think it's your C1, C2. Like, these doctors think like they can just like imagine the problem away. And I think the truth is that they have no fucking idea like how to do their jobs. They have no idea how to diagnose craniocervical instability. It's not hard to do. They just have no fucking idea how to do it. I mean, I can't even imagine that in school they were even trained to do it at all. Like I don't know, like where's the CCI course on the net? Like there's no CCI course, right? So it's like, did they even have any formal training diagnosing it? You know, and then they work all day doing neurosurgery, and do they want to go home and spend like 2 hours a night like reading about CCI for the next 3 months to like brush up on it? Like, no, they don't want to do that shit, so they don't. So it's like, you know, I can get that, but at the same time, they act like, you know, they know what they're talking about. It's like, dude, you don't know what the fuck you're talking about. Like, Jesus Christ. So, um, it's just the astounding stupidity of being like, I felt a tear here in my neck. Oh, I can't fucking hold my head up anymore. And then doctors looking you in the eye and be like, oh, I think it's like maybe your lower neck that's the problem. It's like, how dumb? How could you be that stupid? Like, the amount of drugs that I would have to do to make my brain that fucking stupid. Like, I, I don't think I could drink that much alcohol or smoke that much weed. I think I'd literally pass out before I became that stupid, because I'd be 12 beers in and I'd still do a better job than them at diagnosing CCI. Like, it just, I don't know. I don't know. And these are guys that we revere like holy men and women. Like, we're like, you are the knowers of the information, and you are the holy people whom we trust with our health. And it's like, they're fucking stupid. I trust them less than car mechanics. Because a car mechanic, I've found, will often be more honest with you and say, you know what, I don't know. You know, you're going to have to take it to maybe this guy over here. He might help you. I see that more often, honesty with car mechanics, than I do with medical professionals. Especially doctors. Nurses would be more honest. Doctors are like on the lowest end of the totem pole. You can trust doctors the least. Nurses, like, are they like, I really want to help. I don't know why that is. I don't know why nurses want to help people so much, and like doctors are like, how can I like not help you, but at the same time appear smart and have everyone love me? Like, it's like, seems to be like the main consideration of doctors. Like, there's no like hustle. There's no like, we're gonna figure this out. Doctors don't say that shit. Nurses will. I've had multiple nurses say, you know, they really want to help me and they want to test me and try to do shit. I've never had a doctor do that. I've seen more than 120 doctors in the last 3 years. I've never had a doctor do that. Um, Doctors just seem angry that I know anything. They're like, but I'm the one who's supposed to know things. I'm special. I'm like, no, you're not. You're not special. So, yeah. And I've seen that a lot, like in my field, in cybersecurity. You get guys who are like senior level people and they have like rank or whatever, and like, and you know more than they do, and it just like hurts them on like a deep emotional level. When I'm senior and I have young people come in, like 21-year-old, 25-year-old kids coming in and being like, you know, I know this and that, I'm like, thank God you can do that work. You know, that's less work for me. But these doctors and like, you get senior people, they like let shit get into their head and they're like, no, that can't be real. It's just like, why not? Like, you're just a fucking person. You're not special. Like, you just, I don't know. So anyway, that's me. Probably gonna do euthanasia in a month, but we'll see. Um, Used to get emotional about it. Now I give a fuck. You know, I just want to die or get better, and I don't really care. This was a nice day. This spending some time outside, so that helps. It's gonna be cold up here soon, so I'm trying to spend the time outside. And yeah, so that's my fucked up life. Um, the zero gravity chairs have been a godsend because if like I'm like I can lean back like I'm almost flat now. But like if I'm feeling a little strong, like if I'm feeling a little stronger, I can be up more upright, or I can be mostly upright, and like even take this away, um, and sit here for a bit to like, But a regular chair I can't do. Even reclining chairs, it's really difficult. The zero gravity ones really help. So I'd say if you have neck problems, like you have to get a zero gravity chair because it allows you to be upright, and you really need to be upright for blood flow because you'll fuck up your feet, you'll fuck up your hands, your stomach. Like you need to be upright for a certain amount of time. I don't know how much time is good to be upright at that, but you can't just be laying down all the time. So this lets me do it, and then when I get tired, I can push it back some, and I can put this on my neck to like help. And these chairs are not expensive, and you can get them on Amazon Marketplace or Facebook Marketplace used. And this isn't even the right size for me. Like my feet hang off the edge. I don't care. Like it's just, you got to get a zero gravity chair if you've got neck issues. Because like I can't sit in any other chair. For like the last 3 years, I haven't been able to sit. Well, not last 3 years. Since February. Yeah, I think that's about it. I don't know what I'm gonna do. I think I have like no money, and I have like one free Lyft ride, so I think I can go lift myself to an appointment downtown in Columbus to like get the place to do my MRI, and then I can just beg for a ride home or something. I don't know, but I think I gotta try to get the MRI. There's no point to do anything with Dr. There's only I think it's only like a 10% chance he's gonna operate on me, but if I'm gonna do it, I need that MRI. So, and otherwise, yeah, then it's just if in December, December 7th, I have a disability hearing, and if they approve me, then maybe I could do some more regenerative therapy. I mean, posterior injections in Tampa were the only thing that ever helped with that C1, C2 grinding. The posterior injections Dr. Schultz does in Colorado are pretty shit compared to what Dr. Pappas does in Tampa. And I don't know why, but when Dr. Pappas did posteriors on me, it was like I felt it. Like he stuffed my ligaments full of blood. And when Dr. Schultz did my ligaments, I was like, I don't feel anything. Like, I felt nothing ever. There's no like honeymoon period. I just felt nothing. It was like he never injected me. So he must have done like, I guess a lower amount. And I don't know why. Like, is he afraid of like causing me pain? I'm like, dude, I fucking spent $13,000 and I'm in constant pain anyway. Like, fucking give me the juice. I want to heal. And he's just like, yeah, but I don't want people to be uncomfortable. Like, I don't like. What are you doing? Like, I even heard, like, he literally, his patients have said that he has told them he injected more stem cells in them on follow-ups because he wanted to actually make a difference. And I'm like, well, why wouldn't you do that on the first? Why wouldn't you do that initially? Like, I think unless you experience what we experience, you don't know. Like, you can see people suffering, but you don't know unless you've been through it. You don't know what it's like to want to cut your own throat every single day, for years. You don't know unless you have lived that life. You don't know what it's like when the rest of your body goes to shit, when you lose all your friends, when your family abandons you. Like, when the entire world who has always said, oh, like this, we try to help each other and we're good and all this shit, when you contact religious places and they're like, no, you're on your own. Like, nobody gives a fuck if you fucking die. And you have to live with that. You don't understand what suffering is unless you live through this. And I think he doesn't understand. And Dr. Papas himself has had now Dr. Schultz, I think, has had severe neck trauma, so you'd think you would understand, but I don't know. I got the impression I got very little like sympathy from him. I don't know. He's older. It's a generational thing how he expresses himself. I don't know. Dr. Papas had whiplash and was suffering pretty bad and got injections. I don't know. He didn't suffer like I did either, though, so I don't know. All I know is I got injections, and then for sure I got injections with Dr. Papas, and it was a huge difference. And when I got injections with Dr. Schultz, it was like, did you do anything? Like, I don't think it felt like he didn't do anything, like at all. Like if it wasn't for my throat pain, they actually sent me images of the needle inside my neck injecting the alar ligaments, because I was like, I need to see what you guys did, and um, so I know they did it, but I don't know. I feel like they didn't really inject all that much. You know, I bet if they injected twice as, I bet they could have injected twice as much as they did, and they didn't do it. And what reason that is, who knows? Because I can't ever get a doctor to admit they made a mistake or confront that they made a mistake without throwing a hissy fit and acting like a toddler. So who fucking knows? God forbid any of these fucking geniuses, quote unquote, come online and talk to us on Facebook and actually deal with some real fucking questions. So yeah, that's about it. Hopefully soon I'll be either on my way to euthanasia or on my way to regenerative therapy if I get the disability. If they don't approve me for disability, then I'm just dead. So if I might have to take my own life, but that's it. That's a wrap. Because they're not going to do neurosurgery on me. I won't be able to perform regenerative therapy. That's it. I'm not going to live the rest of my life like this. So please don't call the cops on me. I don't need more stress in my life. They can't help me. Thank you.